So we are going to give you an overview of what's going on at the Myton Hospices within our inpatient services, our outpatient services, remind you of where to find our useful online resources, and hopefully have time for questions and answers. And we know your time is precious, so we're hoping to do all this within half an hour. So I'm going to hand over to Emma now, who's going to talk about the inpatient services. If I could just remind those of you to turn your microphone off, that would be great. Thank you.
Thanks, Sarah. So yeah, I'm Emma Russell. So I've got some information to share with you about our inpatient services today. Just a little overview and some COVID updates, if that's okay. So we have two inpatient units, one in Coventry and one in Warwick. At the moment, we've got 12 beds available in Coventry and 8 beds in Warwick, although our Warwick unit will be increasing to 12 beds from next Tuesday, which is good news. So the reasons people are referred to us for an inpatient stay are mainly for symptom control, which could involve anything physical, psychological, and for terminal care, so those patients in the last days to weeks of life. At the moment, we're not offering respite care, but we are looking at how we can reintroduce that and how we can do it well for our patients. So in terms of COVID at the moment, our inpatient referrals, if they're coming from a hospital, they need a COVID test before they come. And our community referrals will do the COVID PCR when they arrive with us. At the moment, we can accept patients requiring aerosol generating procedures, but only into our Warwick unit at the moment. Thank you. So our inpatient referrals, our referrals team cover Monday to Thursday 8 AM till 6 PM and Friday 8 till 5, not including bank holidays. Anything outside these hours will go to the nurse in charge on the Coventry unit. And the best way to make a referral is to phone us and come through to our referrals team, who can ask all the information that they need for a referral. So that's probably the easiest way than doing the online referral for the inpatient unit. Thank you. So at the moment, all of our patients are nursed in single rooms. And again, that's mainly a COVID precaution. We do have the facility to cohort patients in double rooms, but at the moment we're keeping them in single rooms. And all of our rooms are on the ground floor with access to our gardens, which is really lovely. Patients are able to have their pets visit, and we also have now a smoking room for patients both in Coventry and Warwick. We have facilities for families, so we've got 2 flats on each site, quiet rooms and relatives rooms, and relatives are able to order food from our menu between 9 and 5, and we do have vending machines. And one of the things our patients love the most is our jacuzzi bath, which we have at both sites. And then just to update you about visiting, because we have changed our guidance recently, we are still remaining cautious in terms of visitors and COVID. So we are asking for a maximum of 6 visitors per patient. And generally those 6 visitors will be nominated by the patient. We're asking for only 2 visitors at one time. And we're still asking visitors to undertake lateral flow tests, which they will show to our reception on arrival. We are able to provide those kits if the visitors don't have them. And we're still asking visitors to wear PPE, follow hand washing guidance and social distancing. Obviously, if anybody is symptomatic or confirmed with COVID, they're not able to visit. For patients that are deteriorating in the last hours or days of life, then the ward manager can sort of with discretion allow further visiting, but obviously it needs to go through the ward manager. And then I'll hand you over to Jodie to talk about our outpatient services.
Thanks, Emma. So I'm just going to give you a quick overview regarding our community outpatient services. So obviously that fits under that remit is our patient and carer wellbeing services. So the overall aim of this service is for a patient to be referred along with their family member, and a holistic assessment is undertaken by a registered nurse. So we're trying to identify what is important to that individual and what support's required, what their goals are. We have conversations regarding advanced care planning. We look at how our multidisciplinary team can provide therapy support from an OT and physio perspective, also complementary therapy, counselling and spiritual and pastoral care. So the referrals can be made via ringing the either South referral or healthcare professional referral, and the details are included in this slide that's currently displayed at the minute. Thank you. So some of the offers that are currently in place, and obviously we've had to change this quite drastically due to COVID, has been very much online, virtual support groups and over the phone assessments and follow-up phone calls. We're currently looking at a plan of how we can bring our patients and carers on site, hopefully the beginning of June. And we're just working up that programme, so they will be the sessions will be accessed for our wellbeing patients and carers, and they will be booked in via our multidisciplinary team depending on the need. So we also have our fatigue and breathless clinic that's delivered as an outpatient, and this is a healthcare professional referral only, and as you can see the bullet points there, the patient needs to obviously fit the criteria, and it isn't appropriate or relevant for patients that are purely experiencing asthma. Again, that can be done a referral form online, or the FAB telephone number has now changed from a Warwick number to a Coventry number, where those referrals are triaged by our therapy team. We also have the lymphedema service that's based primarily in Warwick, but they also provide clinic appointments in Coventry as well, and they obviously see patients with cancer-related lymphedema and non-cancer, and their referral form can be triggered by completing the referral form as displayed on the slide. It's a 9 to 5 Monday to Friday service, and they will see patients at home depending on the patient's needs. Then we have our Myton at Home service. This is 2 teams that are under the Myton at Home umbrella, and they cover Rugby, Leamington and Warwick. This is a 7-day service that covers day visits and night sits in Rugby, and they work alongside the district nurse to plan the care that's required. We've also got a clinical nurse practitioner role that's been recently implemented within the Warwick team. The patients are primarily in their last week, 6 weeks, days, hours of life, and we support rapid discharge, home to die, and also fast track. The patient needs to have a fast track in place. Again, the referrals can be made via our Rugby or Warwick numbers to our Myton at Home nurses. And these are NAs and registered nurses that go out to the patient's home and provide personal care and also psychological support, and will provide some bereavement follow-up as well. Thank you. This is just a slide then that leads us on to some useful resources. Olivia, I'm handing over.
Yeah, these are some of the resources that we have available. We find it very useful actually for referrers to download information, leaflets to give to patients. We also found what has been really useful over the period of COVID was the virtual tours. It enabled patients to get very familiar with the environment and also to feel comfortable with visiting. We also have a quick guide reference for healthcare professionals to refer to. Sometimes it's hard to absorb all the information about our services, so we do have a quick reference guide, as you can see at the bottom right, and that's quite useful to know. If you have any questions at all about our services, our provisions, please don't hesitate to contact our referrals team, and we are very happy to help. If you have a patient that you're unsure about if they'd fit any of our criteria, please do give us a ring. We're very happy to talk to you. We've also introduced recently is that we'll never discharge a patient. And what we mean by that is that patients where we had in our outpatient services, where people had a set period of intervention, now we actually say if a patient is doing really well, it's like having an olive branch. They can come and go as they're based upon their priorities and their concerns. And that really makes a big difference, both to the patient, but also the carers. Going forward, if you have, within your team, your clinical teams, if you feel that you'd like to know more information about Myton or just a bit of a catch up with your team, I'm very happy to come out to your team and give you an update about our services. All of our referral information is on our website, including this event. So please do have a look at our website regularly as it is updated. Next slide. Over to you, Sarah.
Thanks, everybody. We just wanted to say thank you to all of you as well, because without our referrers, we would not be able to provide the services that we do. And we very much want to continue to work in partnership with you all. Please do contact us if you've got any queries, and if you're not sure about referring a patient to us, we'd much rather have a conversation with you and help highlight to you the services which may be beneficial for you.